Ruth, I am super excited about our 7 minute schemas today. We are talking about a topic that's received some traction in Australia recently, where people are starting to recognize that they've got ADHD. And I think what's happening for some clinicians is that they'll be seeing people and they're starting to question, is this somebody who has ADHD in front of me? And I'm so super, super pleased that we've got Dr. Shapiro from New York, who is a psychiatrist and a schema therapist and an expert on ADHD.
Yes, Rita. He trained at Harvard Medical School, worked with Massachusetts General Hospital and Mount Auburn Hospital. He served as the Director of Psychiatry at St. Vincent's Catholic Medical Center, Infectious Diseases Unit in New York City, and has worked at the Hollowell Center as well. As part of his training, he also runs a private practice based in New York, and he specializes in adult ADHD.
Thank you so much for inviting me. And I was thinking that what would be most helpful, uh, Ruth and Rita, to start off with would maybe be a typical case example. All the details of this case have been changed, but this would be a typical case that I would see. So let's say there's someone, let's call her Ellen. She's a 45-year-old married woman with two children. And she comes to see me because she was just put on a PIP, a performance improvement plan, meaning that her manager or the company have noticed that there's some struggles that she's having. And she's very nervous that she's going to lose her job. And so this precipitates her to seeing a therapist and a psychiatrist for the very first time. So when we meet, she tells me that she's been very anxious, but a lot of the problems that she's been having have been going on since a very young child. She struggled, she remembers, ever since second or third grade. She would often feel like she was in a fog. She would daydream a lot, was very distractible, was not hyperactive like you might think of young children with ADHD as having, often wouldn't do her homework. But what she experienced was a lot of criticism coming from her teachers, her parents, often punishment. They would say, "You have so much more potential. You're not living up to your potential. What's going on?" And so she frequently would be punished by her parents or scolded by her parents for not performing as well as they thought that she should be. And for herself, she felt very, very confused. She wanted to do well. At the beginning of every semester, she would say to herself, "This time it's going to be different. I'm going to work hard and do what my parents say to do." And she just would not understand what was going on very often in many of her classes, often would struggle with her homework, staying up very late, would often miss appointments, be late for her projects. And this continued through much of her life. Around seventh grade, she developed severe anxiety, leading to significant social anxiety. And yet she never got much support or involvement from her parents about what was going on. Have you ever been evaluated for ADHD? And she never suspected this at all. People where she was from, didn't see psychiatrists. No one really talked about this. And she went and got evaluated for ADHD. And it turned out that, sure enough, she did have significant anxiety, but was diagnosed with moderate to severe ADHD that she had been struggling with from a very young age.
And they're I think, challenges, aren't they, that when people have had a later diagnosis with ADHD, not in childhood, when they've had that later, they've already incorporated a lot of messages about who I am as a person, what I'm capable of. My sense is they would have developed quite a strong internalized critic from all of that. What other kinds of schemas or modes might develop in that type of presentation?
So you could imagine, really starting to think as she was becoming aware how much different she was performing from her peers, that she developed a very strong inner critic,
Mm.
developed definitely the schemas of defectiveness and failure.
Mm-hmm.
And because of receiving so much punishment and criticism and disappointment from her parents, really developed a schema of emotional deprivation.
Mhm.
not really getting the guidance, the nurturing, the support that she needed, because so much was focused on you need to do better, you need to do better. And it was a constant battle for much of her childhood. And so some of the big schemas were those, the defectiveness, the failure and the emotional deprivation. But another schema that can often develop a little bit paradoxically is unrelenting standards. That even though she was struggling with school and not doing well, she was determined and motivated to do well, and therefore really would push herself and would spend 2 or 3 times longer on her work and assignments than her peers, and yet still not living up to what she wanted and what her parents wanted her to do. And so really developed this very strong scheme of unrelenting standards.
And Scott, if we were to go back to this case study's kind of early experiences, because this is what we do in imagery rescripting, right? We'd go
Yes.
back and try and kind of correct some of these messages.
During imagery, whether it's during the assessment or during limited reparenting or rescripting, I often go into the imagery and talk to the parents that if you are having a child struggling with migraines or with chronic stomach pain or with any other medical issue, you would hopefully seek out medical support. And I would confront the parents and say, obviously, something is going on. You keep on telling your daughter that she's lazy, that she's not living up to her potential. And yet, what you need to do is to explore all potential options about what else might be going on. They would have perhaps needed, and I think Ellen needed this, the support of you realizing that there's some struggling, perhaps getting some assessments, speaking with her teachers, perhaps getting additional support from tutors, and really finding out what's going on and helping her to know that she's not alone in this. She's a little girl.
Well, that's so helpful for us as clinicians, and I'm sure it's helpful for people watching to start to kind of understand the way schemas, modes play out. If you want to find out more information about Dr. Shapiro's work, you can visit his website. That's going to be linked at the bottom. But that's our 7 minutes.